The views, opinions, and presentations of the guest are not intended to establish a standard of care to be followed by the audience. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding your health. Furthermore, the assumptions, views, opinions, and insinuations made by the host and guest do not reflect those of the show and the management. Zach at Zydus brings you a patient care program Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.
Po ang inyong araw ngayong araw ng linggo. Today is the 25th of October. And I hope that you will stay with us hanggang alas 4 po tayo this afternoon as we talk about something interesting na naman na pag-uusapan natin. And this talks about dementia. Malalaman natin yung details na mamaya. Of course, kasama ang ating speaker, which I will be introducing a little bit later. But before that, we're saying good afternoon muna sa mga unang nag-tune in sa atin. Walang sawang na nanonood sa atin every week ng Health Talk. We're saying good afternoon kay Miss Carol Magsakay, Miss Susana Carol Hico, kay Jonabel Magwad, and also kay Grace na nanonood ngayon. Dr. Beth Santos, good afternoon to you and thank you so much for watching. Ang ganda ng iyong performance last night sa Musikatria. Kay Mike Perey, also good afternoon. Kay Alma na kakapasok laban, good afternoon din sa iyo. We'll be back later with some interaction after the presentation of our speaker. But this afternoon, let me introduce to you our speaker. He is none other than Dr. Robert Buenaventura or Dr. Bong Buenaventura sa kanyang mga colleagues. He is a psychiatrist and a psychogeriatrician. Dr. Buenaventura finished his Bachelor of Science major in clinical psychology, take note, magna cum laude, at the Far Eastern University. He then pursued his Doctor of Medicine at the University of the East, Ramon Magsaysay Memorial Medical Center, College of Medicine, and his residency training in general psychiatry at the UERM Memorial Hospital. And then he further attended postgraduate training in psychiatry of old age at the New South Wales Institute of Psychiatry in Sydney, Australia. Dr. Buenaventura is a diplomate of the Philippine Board of Psychiatry. He is a life fellow of the Philippine Psychiatric Association and former editor-in-chief of the Philippine Journal of Psychiatry. Yung passion niya sa kanyang field landed him several involvements. He is currently the secretary of the Certification Committee of the Specialty Board of the Philippine Psychiatry. He's also the treasurer of the Board of Directors of the PPA and currently a consultant psychiatrist at the UERM Memorial Hospital in Quezon City. And he is also the head of the Department of Neurosciences in Manila Theological College, College of Medicine in Santa Ana, Manila. It's nice to have you with us today. Welcome to Health Talk, Dr. Bong, and I'm sure yung audience natin are excited to learn more about our topic on dementia.
Thank you very much, Fort. Okay. Good afternoon, Forts. So thank you very much for that very kind introduction. Okay. And I'm also very excited to be here, to be with you this afternoon. Maulan na hapon, pero hopefully we'll have a good discussion on this very important topic. Okay. So let's start. So again, ang pag-usapan po natin ngayong hapon, yung pag-aalala nila Lolo't Lola sa kanilang alaala. Okay. So this is a very common situation as we grow older, particularly in the Philippines, because there's a lot of misconceptions about growing old, about some of the problems that the elderly encounter. So hopefully during the discussion and then during the open forum, we'll be able to discuss all those little things. Okay. So just to start, I'd just like to share with you kung ano yung objective ko. So hope to be able to discuss some aspects about growing old, becoming forgetful, and developing dementia, as Fort has mentioned, and of course, yung impact of the pandemic on the current situation with the elderly. Okay, because it's not something that we'll be able to avoid. Okay. So just briefly, when we talk about aging or yung pagtanda, about growing old, we have to remember it's a biopsychosocial process. So that means we're looking at biological, psychological, and social processes that work together. No, they work together, they intertwine to be able to come up, in terms of what we perceive or what we know of as aging. Okay. So let me talk a little bit about yung mga normal changes as we grow old, because a lot of times some of the normal or expected changes that we encounter as we grow older are perceived to be pathological. Na inisip natin na mukhang hindi na maganda to, pero actually all those things that we might be experiencing could still be considered to be normal. Okay. It's a very exhaustive topic, so I won't go to a lot of that in detail. But just to cite some examples, of normal aging. So yung biological aspect, yung pagputi ng buhok, so pagdevelop na wrinkles, so frailty, panghihina, pagbagal ng paglakad. Okay, so those are normal biological or physiological changes. Ano yung mga psychological changes? For example, slowness in responses, and of course yung one of the more common issues that are critical as far as the elderly is concerned, yung forgetfulness. I'll discuss this in a little bit more detail later on. And then social aspects would include widowhood and becoming grandparents. No? Kaya nga yung topic natin ngayon is focusing on the Lolo't Lola, kasi in terms of the social definitions of aging, sinasabi natin tumatanda na tayo pag nagiging Lolo't Lola na tayo. Okay? So as I mentioned, let's talk a little bit about forgetfulness, because this is something that I'd like to clarify when we talk a little bit more about dementia later on. So forgetfulness or yung pagiging makakalimutin is actually a normal part of aging. That's why we have a term for this which we call age-associated memory impairment, okay, or benign senescent forgetfulness. So these are two related and similar terms. Yung benign senescent forgetfulness, that's a little older, mas nakakatandang term yun. Pero yung mas makabagong term na ginagamit namin, yung age-associated memory impairment. So essentially, as the name implies, these episodes of forgetfulness occur as we grow older. So these are related to aging, and that's why we call it also benign. So that means normal ito, typical, expected, and so there's really no need to worry, okay, about this. So this begs the question, so when is it not normal anymore? Kung sinasabi natin that these are normal or expected or typical, when should we worry? Kailan yung panahon na dapat tayo mag-alala? In terms of my clinical practice as a psychiatrist, and also as a psychogeriatrician, I first and foremost, I would look in terms of the impact of the forgetfulness on the individual's overall functioning. So what do I mean when I say overall functioning? This covers three important areas of our lives, of ourselves. Yung personal functioning, ito yung kakayahan natin to take care of ourselves. So yung self-care natin. Social functioning relates to our capacity to be able to interact or relate with other people, especially those whom we love, especially those whom we are close with, so those people who we live with, yung interaction natin sa kanila. Because social interactions, social relationships are very integral as far as our lives are concerned. So pag naapektuhan na yon, so that means there really must be something significant going on. Then finally, occupational functioning. Although the older we get, the less occupational functioning that we do. Kasi essentially, when we talk about occupational functioning, that relates, for example, to going to school, sa mga estudyante, and then for those who are a bit younger, yung pagtatrabaho nila. But of course, that changes, for example, after we retire, kasi our occupation can become different. For example, a lot of people can become involved in vocational activities, or social-civic organizations, like they become more volunteers with church activities or other social-civic organizations, katulad ng mga Rotary Club, mga ganun. Okay. So when I talk about occupational functioning in the older adult, a lot of older adults, remember, still are gainfully employed. Tulad ng mga karamihan sa mga doktor, marami pa rin sa amin na nagtatrabaho until we reach 70 or 75 or even more. Okay. But for the others who would retire, let's say at the age of 60, 65, yung occupational involvement could refer to other activities that fulfill our time. So that means yung these three areas, no, personal function, social function, and occupational function, should be assessed when we try to determine whether the individual is being adversely impacted by the episodes of forgetfulness. So this brings us to the question of what is dementia? No, kasi nabanggit nga yun ni Forts kanina and also yung sa promo for this interaction. No? So yung sa kasalukuyan kasi, yung dementia, we now refer to it as major neurocognitive disorder. No? Pero that's really just a technical term. So in layman's term, we can still use the word dementia. And it will refer to the same thing. No? So as we know, dementia is a degenerative disorder. So that means nagkakaroon ng pagbabago. Okay, caused primarily by pathological changes in the brain that impair cognitive functioning. So it means when you talk about dementia, naapektuhan yung paraan ng pag-iisip ng tao. No? And one of the first manifestations or earliest manifestations or symptoms of dementia would be problems as far as memory is concerned. Ito na nga yung sinasabi natin, yung forgetfulness. So the question earlier is, if there is such a thing as benign senescent forgetfulness, when does it become pathological? Okay, so as I've mentioned already, we look in terms of overall function and also in terms of the number of manifestations. Another important question that's often asked of me is, ano yung mga kadalasan na dahilan kung bakit nagkaka-dementia ang tao? No? So what are the common causes of dementia? Marami, technically speaking, but the most common accounts for about 75 to 80% of all cases of dementia, not just in the Philippines but worldwide, would be something that we call Alzheimer's disease. Okay. In simplest terms, no, in Alzheimer's disease, nagkakaroon ng parang scar tissues na peklat, sabihin na natin, sa utak, no. And actually, kung konti lang yun, that's normal. It can actually be a normal finding. Kaya lang, the problem with Alzheimer's dementia, there's too much of it, masyadong marami, to the point na, for example, if you think of roads or highways, no, na nababarahan. So parang gano'n, gano'n na nangyayari sa utak ng tao nagkakaroon ng Alzheimer's disease. Yung pagdaloy ng what we call neurotransmission becomes affected or impeded because of certain lesions in the brain. Okay, and kung tulad na sabi ko kanina, kung konti lang siya, it could still be considered to be normal. Pero pag dumadami na siya, then it affects more areas of the brain, then it becomes more pathological. The second most common one is what we attribute to cerebrovascular disease. No? In simpler terms, what we call strokes. No? Although these are generally mga minor strokes, not yung mga major strokes that can lead to, let's say, paralysis of one half of the body. Usually mga cerebrovascular conditions na to, yung mga maliliit lang yung strokes, pero marami, no? And it affects different parts of the brain, and therefore, again, just like with Alzheimer's disease, this prevents the normal transmission of our neurons natin, o yung the way our brain communicates with with different parts become affected. Okay. So other causes could include kung may lesions or tumors in the brain. Meron tayong tinatawag na Lewy body disease, may mga maliliit na parang tumors sa brain that affects also thinking. Also metabolic dysfunction, let's say problems with the levels of let's say naapektuhan yung liver or kidneys or even blood sugar metabolism. This can lead to metabolic dysfunction in the long run pag lumalala na yung condition. And other systemic conditions, diseases such as infections. So infections can also lead to manifestations that may appear to be dementia. So that's why it's very important to be able to rule out all these other causes. But usually makikita naman natin yun sa history ng pasyente, sa pagdaloy ng symptoms niya, how it evolves, how the symptoms develop. We will more or less be able to say whether the patient has which type of or which particular cause of dementia. And that's the reason why when an individual with severe episodes of forgetfulness would be brought for consultation, one of the first things that we would do would be to conduct mga laboratory examinations, mga assessments, so that we will be in a better position to understand the possible cause of the patient's problem. Now, let me talk a little bit about yung differentiation between normal and pathological by citing a case of or tale of two women. Okay, so halimbawa, may dalawang magkumare, sabihin natin si Lola Pia at saka si Lola Catriona, nag-uusap sila sa park. No? Sabi ni Lola Pia kay Lola Catriona, ano nga yung pangalan nung hinanda nung kasal nung anak ni Lola Gloria, si Margarita? Okay. Siyempre, mapapansin niyo mga kapangalan ng mga Miss Universe yung mga lolang ito. So si Lola Pia, hindi niya lang matandaan kung ano yung pangalan ng putahe. Okay? Pero si Lola Catriona, baling sa kanya, parang nagtataka na, anong wedding? Anong kasal? Okay? So, in one situation, you have a woman who just forgets the name of a dish, but you have another woman who forgets the entire event. Okay? So they both attended the same event, but one woman just doesn't remember the name of the dish, but another woman does not remember the entire event. Okay? So mapapansin nyo, kung kayo na makakapagsabi, no, in which instance is it normal and in which instance it becomes pathological. So now let's look in terms of ano yung impact ng COVID-19 pandemic as far as patients, not just with patients with individuals with dementia, but sabihin na natin sa kalahatan ng mga nakakatanda. Because of course the impact of the pandemic has been very widespread, And let's look first in terms of some of the statistics that we have as far as the elderly is concerned. So this was taken, I did this early this month, okay? So makikita nyo, so this was about the first week of October, so it may not be parallel. Yung values, yung exact numbers may not be the same as what we have right now. Pero ang habol ko dito is not the numbers but yung proportions or percentages, okay? So makikita nyo in the red box, no, that box covers the elderly individuals, yung from 60 years old and above, no. And in the smaller box, yung 61 to 70, 71 to 80, 81 to 90, makikita natin, we can see the distribution of the number of cases in that age group and also the number of deaths, no. One of the things that I'd like to emphasize here as far as yung analysis is concerned, that if you look overall, no, the elderly comprise only 11% of all cases, but they account for almost 60% of all deaths, no. So almost 11% lang ng mga kaso, and yet, no, almost 60% of all deaths. 1/10 of all cases, but practically 2/3 of all deaths. So makikita natin yung discrepancy as far as the impact of the pandemic on the older adult. Now, anong effect ngayon ito sa nakakatanda? Okay. First, we need to remember that fear, worry, and anxiety are common and normal and expected responses in a major health crisis such as what we're going through now, yung COVID-19 pandemic. So, hindi kataka-taka na tayo mag-alala, tayo malungkot or malumbay dahil yung pinagdadaan natin na ngayon isang mahalaga, mabigat na bagay. Okay. But we also note, based on nakita sa China, also in the US, no, that the prevalence of anxiety, depression, and insomnia has increased, no, and in fact, in some instances, 5 to 10 times the normal. So, and this is very critical because this affects almost everyone, no. This is across all ages, no. It doesn't affect not just the elderly, but it affects everyone. But kahit mga bata, malilit na apektuhan itong sitwasyon na to. But as far as the elderly is concerned, we see that about 1/3 of them can have significant anxiety and depression. And also, they also show a high degree or a marked degree of distress as well. Okay? And bakit? Okay? Kasi nga, so the question na, so why are the elderly emotionally impacted? Kasi nga, for example, laging sinasabi, laging ina-announce, mga matatanda, huwag kayong lumabas ng bahay kasi vulnerable group kayo, no? So the vulnerability of the elderly to COVID-19 has been very well emphasized, no? So lahat ng announcements sinasabi, the elderly, you should not leave your house because madali kayong dapuan ng COVID-19 at pag nadapuan kayo, mamamatay kayo. And so what does that lead to? So the elderly become afraid, okay? I have patients who have not stepped out of their house since the lockdown started on March 16, okay? And yet they're still terribly afraid that they will catch the disease, okay, even though they have not left their house. And the problem here is that those, yung mga older adults with neurocognitive deficits, no, sabihin na natin hindi lang dementia specifically, but sabihin na natin nagkakaroon ng problema sa pag-iisip, are more at risk and therefore will need more attention. Okay, because why? Because older adults with cognitive decline, they become more anxious, more agitated, and they become more socially withdrawn. So therefore, their specific demands should merit a specific form of attention as well. Okay. So ano pa? So may restrictions brought by quarantine that affects primarily yung mobility ng mga nakakatanda. Kasi 'di ba, as you know, yung mga announcements, no, only those who are 18 to below 60 can go out of the house. So if you're 60 and above, you cannot go out of the house. But the elderly individuals are discouraged from going out. And for those who attempt to go out, they are barred from entering public places like groceries and supermarkets. Gusto nilang mag-grocery, gusto nilang mamili ng gamot nila, pero ayaw silang papasukin dun sa mga areas na yun. Kasi nga, nakakatanda sila. Ang sabi daw, bawal sila. Kaya, this leads to a lot of frustrations on the part of the elderly. And the problem is, for example, what if they live on their own? No? And that's the reason why a lot of elderly individuals broke quarantine, because a lot of them still had to make a living to be able to support themselves and others. Because, for example, alam niyo siguro yung grandparent syndrome na tinatawag, no? Yung mga nag-OFW na nakababata, iniwan nila yung mga anak nila sa mga magulang nila na nakakatanda. Kaya ngayon, ang mga nag-aalaga doon sa mga bata na bawal din lumabas ay yung mga lolo't lola nila na bawal lumabas. Ngayon, kung walang makakalabas sa kanila, sinong bibili ng pagkain? Sinong bibili ng gamot? Ng mga ganon. Kaya yung mga bagay na yun, hindi natin naiisip. Pero importante yun, mahalaga yun para sa mga apektadong tao. So the problem is a lot of elderly individuals had to do this, had to dare and break quarantine because they had no one else to depend on, and they did not be, or if they didn't even want to become a burden to younger members of the family. So, and also isang importante, because there was also limited or no access to healthcare services. Why? Because a lot of outpatient clinics had to close down, di ba? And so what happened was only emergency services or emergency rooms were open. So a lot of older individuals who, as you know, a lot of older individuals have one or more chronic medical conditions like hypertension, diabetes. And so therefore, yung regular visits nila to their physicians had been curtailed, natigil, And this was very critical because how are they going to get their medications? How are they going to get their checkups? What if, they suddenly feel very bad? Later on, I'm going to talk a little bit more about this, but at this point, this was something that was very critical because remember, not all older adults will know how or even will have access to digital technology. Okay, so kahit gustuhin man nilang lumabas, wala naman din silang mapupuntahan para magpagamot kasi nga, outpatient clinics were closed. And in fact, I have one patient whose ENT is an older individual na ngayon naghahanap siya ng ENT na mapupuntahan kasi nga ayaw nang maggumamot, ayaw nang mag-clinic ng ENT niya kasi natatakot na nga rin baka maapektuhan kasi nakakatanda din siya. So there are situations like that we often are not aware of, but we need to consider because it has a significant impact on older adults. So isa pang aspeto, particularly what we see in the Philippines, yung adverse effect on religious practices. Although now it's gotten a little better, but remember, at the start of the lockdown, it was really very difficult, especially during Holy Week, because remember, Holy Week came in April. And the elderly, habit na rin, and because of their vocation, pananampalataya nila, so they wanted to go to church, but they had no way to be able to do it, simply because the church was closed. So they had to resort to watching masses on TV or listening over it on the radio. So as I've mentioned, over the weeks nagbago na naman to, nag-improve, but still there's a limit, and still is a very huge challenge for older adults to be able to go to worship. And this becomes a problem and increases their sense of isolation because for a lot of older adults, going to church on Sundays was frequently the only time they could go out or would even go out of the house. So yun na nga lang yung oras o panahon na sila lalabas ng bahay, natigil pa. So ngayon, wala, talagang nakatenga na lang sila sa bahay. This is what I mentioned earlier, no? So with older adults, there's a limited capability or ability to avail of digital technology. Okay, so that means they often need to depend on younger members of the family to be able to help them out with this, including mga online medical consultation. So this can be something that can be very challenging for them. Okay, so this is something that we need to consider. In fact, one of the patients that I have, 68-year-old woman with thalassemia, she had a difficult time being able to contact her doctor, no, it's because her doctor wasn't on doing online practice. Okay, now it's not just in terms of digital technology, yung consultations that became a problem. Because remember, for example, when an individual with COVID-19 becomes hospitalized, they at that from that moment on they don't have any more communication with the rest of their family. In fact, a 91-year-old mother of a very good friend, died alone in the hospital due to COVID-19 with very little interaction with other members of the family because she did not know how to use a cell phone. Okay, buti yung mga nurses occasionally they would help her out, but on her own she knew how to use a cell phone and be able to communicate with her family. Probably that would have been better for her and for the rest of the family as well. But as it was, because of that lack of interaction and communication, both mother and the rest of her family, that's very frustrating and depressing for the family members at that instance. So we need to consider yung social isolation and quarantine will have a negative effect on elderly individuals. And research has demonstrated that because social connectedness and engagement with other people is very important to us, not just to younger individuals, but more so to older adults. And yung physical distancing policies natin may be uh, a bit more difficult as far as older adults is concerned. Buti nga ngayon, di ba, na-elevate na up to 65, pwede na lumabas. But still, we need to consider na marami pa ring nakakatanda who are beyond 65 who would benefit from being able to. Hindi ko naman sinasabing payagan lahat sila na maglakwatsa, magmalling, ganon. Siyempre, we need to ensure that there are still safeguards in place. But what I'm saying is that there should be more reasonable, more rational ways to be able to deal with this. And that's why it's important for policymakers to be able to consult with end users as well to ensure that their needs are met. Okay. So I keep saying about this, because we talk about physical distancing during public health crisis, but we know this is essential, okay, because it will help prevent the spread of the virus, but it often comes at a high cost to the mental health and well-being of seniors, because physical distancing does not just involve staying 1 or 2 meters away from each other. Oftentimes it also involves strict isolation and quarantine as well, and this is what has a negative impact on the older adult. So we have to remember it's not easy to cope with prolonged confinement. Kahit sino naman, yung iba nga sa atin, 2 weeks, 3 weeks, nabuburyong na tayo. So, but what about individuals who have been homebound since March 16 up to now? Mag-end of October na, mag-uundas na, okay? So it's not easy to deal with that. So amidst all this mandated isolation, the elderly may experience depressive symptoms, loneliness, pessimism, deterioration in their cognition, and disruption in sleeping patterns. In fact, yung insomnia, that's one of the more common reasons why elderly patients now are consulting, because talagang naapektuhan na pati pagtulog nila, gana sa pagkain, okay? So hindi lang emotional ang impact noon, which also been shown by studies, that isolation and quarantine will also put the elderly at heightened risk of cardiovascular, autoimmune, and additional neurocognitive problems. So this creates sort of a vicious cycle, Ayaw natin silang palabasin dahil pinangangalagaan natin sila, pero yung hindi naman nila paglabas, hindi naman maganda ang epekto sa kanila. So that means we need to really be very considerate about the policies regarding isolation and quarantine. And particularly for individuals with dementia, as I mentioned earlier, this increases the risk of agitation and restlessness. Kasi one of the symptoms of dementia is what we call wandering behavior. Then their need to walk about, walk around. Kaya may mga families, what they do is they, sinasamahan nila yung nakakatanda before the quarantine to, no, sa paglalakad in the neighborhood. But since pinagbawal yon, lalo na kung maliit lang yung bahay nyo, and it becomes it can feel very constricting, no, on constraining. Kaya, and as a result, the elderly, particularly those who with underlying dementia, can become more agitated and restless. So how can we help them? Fortunately, there are already primary supportive measures from the World Health Organization, United Nations, and the Department of Health. I'm not going to go through them one by one because they're all available from Google naman, so you can just do a Google search. From the WHO, this came out as early as March, no? And this is just one section of the entire recommendations that they have as far as the mental health and psychological considerations in the COVID-19 outbreak. And this section just refers particularly to older adults, okay? And this one is a little bit more comprehensive. This is from the Interagency Standing Committee of the United Nations. Ang maganda dito kasi merong specific discussion about individuals with dementia, yung mga elderly individuals with cognitive deficits. And that's why I feel that this is a little bit more helpful. And then finally, from the Philippine Council of Mental Health of the Department of Health, they came up with this short but succinct, direct to the point guidelines on how to promote psychosocial well-being in the older adults or the elderly. Very good key points that we can follow. Okay. So, but what kung nakakatanda ka and then nakikinig ngayon, if you're an older adult, what are some of the coping strategies that you can do? Some lang to, hindi lahat kasi napakarami. So I've just gotten some of which I feel are pertinent or important from the previous resources that we have. So being positive and hopeful, caring for ourselves, ensuring that we eat well, hydrate well, praying has been shown by studies to be very helpful for elderly individuals, not just during this time, but at any other time. Bonding with loved ones. So if you know someone who's isolated, and just reach out to them, whether by text, by call, in whatever means. If you can do that, then that would be great. So being with your loved ones is great, but we need to remember there are a lot of other individuals who are living on their own and therefore may feel very, very isolated. Okay. And then finally, exercise. And not finally, but next is exercise. So kahit walking within the house, kasi nga di sila makalabas, kaya may mga pasyente ako, gusto ko rin silang maglakad kahit 20 to 30 minutes a day, but they cannot because pinagbabawalan sila once they step off the house. People tell them you should not be going out, and also their family members are afraid to let them step out of their grounds. Kaya yung exercise nila, walking in place in the house, in the living room. So what else? Just rely on credible information, tulad ng binanggit ko kanina from the World Health Organization, Department of Health. Just limit it to that. Don't read a lot of things, because that can produce overwhelming information. Kasi remember, there's a lot of misinformation or fake news going about. Be productive, help, donate, volunteer, share. There's a lot of things that we can do. Limit access to mass media and social media. Don't check Facebook all the time, okay, or Twitter if you're on that. And do enjoyable activities, especially together with your loved ones, your family, your friends, okay? And then be able to talk to someone. All of us, each one of us, would really be helped by someone who we can talk to, who can listen to us, makikinig sa atin, who can give us good advice, because it helps lessen our sense of isolation. It also allows us to be able to vent and express our fears and our frustrations, okay? So for the younger members of the family, what can you do to help your older adult? Okay, so monitor their health. If they have a chronic medical condition, like hypertension or diabetes, make sure they're taking their medications. Okay, make sure they're eating right, sleeping well, drinking right. Okay. Help them with practical aspects of daily living, such as buying their groceries, cleaning their house, and even paying their bills. I'm sure they would appreciate you more if you pay for their bills. And then provide simplified but comprehensive information. So as every time the IITF comes up with guidelines, simplify it for them, explain it to them so that they will understand it much better. So we know, for example, yung safety precautions like hand washing, hand sanitizing, wearing of face masks and face shields, yung mga bagay na ganon. Let us be able to help them understand that better. Okay. So what else can we do? Ensure regular and consistent contacts with family and friends, as I've mentioned earlier, through, let's say, through digital means, through FaceTime, through Messenger, or even kahit texting lang, kahit landlines, okay? As long as we connect with them. And then, yun na nga, for older adults who do not have access or who do not know how to access digital technology, let's help them out, no? Facilitate their access, teach them, okay? Including, more importantly, yung telemedicine consults, so that they'll be able to consult with doctors as far as their conditions are concerned, and develop and maintain a routine for them so that they will that can help. If you have a schedule that will help them in terms of yung circadian rhythm nila, makakatulong din yon para sa pagtulog nila sa gabi. Okay, if they have a schedule routine to follow. Filter the access to mass media and social media, as I've mentioned earlier. Lend an ear, makinig tayo sa kanila. This is the easiest and most impactful thing that we can do for them. Okay, and then reassure them if they're feeling anxious, if they're feeling depressed, that what they're feeling is still normal. No? Kasi sabi nga sa panahon na to, it's okay not to be okay. No? Pero babantayan din natin kung lumalagpas na yun sa hangganan ng kung saan okay pa. Okay? Okay. So, just to wrap up, all of us, especially our government leaders, need to understand that the elderly is a very heterogeneous group of individuals. Kasi pag sinabi mong 60 and above, ang dami niyan, may mga 100 years old tayo. Yung mga 60 to 65, even up to 70, kaya pa nilang magtrabaho, di ba? Kaya pa nilang pangalagaan ang sarili nila. So that means they should be able to go to the grocery, buy things, go to the drugstore. Okay? So we're looking at a different cohort of several generations with varied needs, wants, and capabilities, no? So that's why we should not consider them just as one, no? Na isa lang sila. We should not lump them all together as one single group kasi magkakaiba ang mga pangangailangan nila. And since we've reviewed yung impact ng COVID-19 on the elderly Philippines, we've seen that actually in the Philippines, the older adults, yung mga senior citizens, they only constitute about 9%, almost 9% of the total population. And yet you can see they account for 11% of all cases and almost 60% of all deaths. So very disproportionate naman talaga. Okay? And this underscores what we already know, that as an age group, the elderly are at a higher risk than any other age group with greater morbidity and mortality for this disease. And therefore, this has resulted in biological, psychological, social, and spiritual problems for the elderly. And therefore, we need to understand that there's a lot that they can do to help themselves and a lot that we can do as well. Therefore, it becomes imperative that we all take very good care of them. So I just have one simple request, hug your mom. And with that, I'd like to end my lecture and to thank you for your kind attention. So magandang hapon po sa inyo lahat at maraming pong salamat sa inyong pakikinig. So I turn it over back to Mr. Fort Sagabay.
Maraming salamat, Doctor, for that very interesting presentation. I like the way how you segmentize yung presentation mo now when you talk about first what the normal activities and then ano yung hindi normal and then you move into dementia and then yung mga causes, yung current issues and then yung coping strategies. You mentioned earlier about the role of the government. Mamaya may itatanong ako niyan, no? But later on itatanong ko yan. I'm just overwhelmed with a lot of questions that's popping in right now, left and right. Meron sa Facebook, may sa text message, okay, mamaya meron din sa Viber. But before that, we're saying good afternoon muna kay Dr. Rhea Concepcion. Sabi niya, it's very practical and timely lecture that we have this afternoon. Thank you, Dr. Bong, for this one. Also, we're saying good afternoon kay
Concepcion.
Yeah, good afternoon kay John Michael Reyes, kay Gemma Okawa, kay Marta Tolentino, John Ray Jersey, sabi niya it's nice to be part of Health Talk. Good afternoon kay Junie Marshall from Cagayan de Oro, kay Alan Toto Astrologo, good afternoon din, Erwin Galvez, kay Jerwin Cabrera, kay Getel Santos Manalang, Jane Taneo, Angie Dishon, kay Mark Reyes, Jomel Lastimosa, Mau Brillantes, meron pa, konti na lang, Doktor. Jomel Lastimosa, Maria Arumin, and kay Klang, and kay Oneng na nakikinig. We also have listeners from Indonesia.
Okay.
Si Paolo. From Dubai naman, we have Donna na nakikinig ngayon. And from Quezon City, si June. Attorney June. Ayan. Good afternoon sa inyo lahat. Okay,
Magandang hapon
Doctor.
sa inyo lahat.
Okay, so let's jumpstart this discussion because you mentioned about the government, no? Yung unang tanong ko dito is, did the Geriatric Association or Society ba already put this through sa government about this concern about the elderly?
Ang maganda naman kasi, for example, with the IATF, they had medical consultants as well. So some of these issues I know were brought up with them. And also, another important considerations that a lot of organizations, for example, yung Dementia Society of the Philippines, and especially Alzheimer's Disease Association of the Philippines, they came up with their Facebook page about guidelines in terms of helping the older adult, which personally I also found very helpful, no? And which I also shared with some of my patients. So may mga groups naman that have been very helpful. The thing naman kasi, the issues that we have oftentimes is that we need to remember kasi then there's so much information that it becomes very challenging to be able to sift through that. But hopefully mga recommendations can come across. And then, kasi then different levels of priority kasi yan eh.
Okay. Meron pang question dito that talks about, are Filipinos now more aware ba na pag-ulyanin it's something that needs medical attention? Kasi di ba, commonly feeling natin normal lang yan because it's just part of aging. Your thoughts on this?
This is a common issue that I bring up with, for example, with residents when I do supervision with them. Yung konsepto kasi natin ng ulyanin, pag-uulyanin, Filipinos kasi assume that, again, this is a misconception, no? Part of what we refer to as ageism, na mga misconceptions in relation to growing old. Yung pag-uulyanin kasi sa Pilipinas, inisip ng karamihan na normal yun. Okay? Pag naging ulyanin ka, okay lang yung normal yan kasi tumatanda ka. But the problem is, it often leads to a delay in consultation and even treatment. Okay? So, if we ang kaya sa akin, kumbaga, it's better to err on the side of caution, ika nga. No? So, mabuti nang kung nagkakaroon na ng problema sa memory na medyo, mukhang hindi niya na nakikilala yung mga anak niya. Dali na natin. Wag na nating pagtawanan si Lola. Si Lola ko, nagiging makakalimutin yung mga ganun. O nagiging mali-mali. Okay. Kasi nga, tingin natin, tama lang, okay lang yun sa pagtanda. No, at a certain point, forgetfulness, as I mentioned, is fine. But at beyond a certain point, we should be worried and do something about it.
Okay. Doctor, you mentioned, no, kanina sa presentation mo, hindi naman lahat ng mga matatanda will have dementia. Siyempre, may mga matatanda din na hindi makakaranas nito. Do we have this age ba na dapat kailangan may pre-screening na tinatawag?
Well, ideally, as you grow older, kahit late middle age, you can undergo screening if you want to. Kasi wala namang masama sa screening, For example, like mammography and yung digital rectal exam for prostate cancer or pagkuha ng PSA, prostatic specific antigen, di ba nire-recommend yan at certain ages, no? So, sa akin walang masama kasi screening lang naman okay? Because that will be helpful. Especially because it can provide yung baseline information. No? So we know that when this person was 50 years old, ito yung score niya sa screening na to. So kung let's say when he turns 65, nagkaroon ng kapansing-pansing pagbabago, if they do the screening again, then they have a point of comparison. Okay. So sa akin walang masama doon, and that's a good point that you've raised and something that can be helpful overall.
So I guess we just want to reinforce sa mga nanonood ngayon na mas maganda kung gawin nating part talaga ng ng pagtanda siguro ng parents natin or tayo mismo, no, to have ourselves parang screen so that we know kung may mga symptoms ba tayo na ma-develop, di ba? Kasi most of the time minsan dinadala na yung patient sa clinic ng doktor, nasa moderate stage na siya di ba? Or nasa severe stage na.
Oh,
so
yes.
maganda maagapan. Although there's no cure as of this time, Doctor. We can only delay it. Diba?
Right. We can slow down the process. But a good point that you raised kasi yung by the time they brought to the clinic, I've seen in since the lockdown started, I've seen 5, 6 patients who were brought to me. Kasi nga, di ba since na lockdown, everyone is at home. So ngayon napapansin nila, aba, si Lola pala may nakikitang mga kung ano-ano yung gano'n. Tsaka nila dadalhin. Yung pala, that problem has been around. I mean, may memory deficits na if you take the history, makikita natin na ang tagal na pala, meron ng mga symptoms earlier pa, pero hindi, napapabayaan. Pero when they were all together, 24/7, tsaka nila napansin, nakakaiba na pala to. So that's the time they consult. So the challenge there, sabi mo nga, no, a lot of treatments would be more beneficial if we start them early. Kaya kung medyo naantala, okay pa rin, magagawan pa rin natin ng paraan. Pero syempre, mas nakakabuti sa may karamdaman kung mas maaga natin malapatan ng lunas.
Yeah. Just want to read this from a viewer, si Maria Arumin. Sabi niya, it's good for the government. They provide as a work from home for the 60 and above who are still working. To add to what we have discussed earlier about the role of the government. Okay.
Right.
Now, let's rewind a little bit sa mga younger generation naman, Doctor. Minsan, alam mo yung sa bahay, naging biruan lang, pero yung nakakalimot ka, na minsan madalas na nakakalimot, is this something to do with, future case of dementia? Alam mo yun, minsan nakakalimutan mo na yung susi. Normal lang naman yun na nakakalimot tayo, di ba? Pero pag naging palagi na, nakakalimutan mag-flash ng CR. Di ba? Nakakalimutan mo yung eyeglasses mo, yun pala, nasa ulo mo lang. Ano yung thoughts mo doon?
Sandali, hanapin ko lang yung salamin ko na nawawala. Kanina ko pa na.
Di ba yung mga gano'n?
A memory kasi is very complex. In fact, one of the common questions that they ask psychiatrists and neurologists is which part of the brain is responsible for memory. The problem is, no, kasi when you talk about memory, may visual yan, may auditory yan, may tactile yan, may olfactory. So there are different aspects of the memory. Kaya sometimes, di ba, like the sound of a particular song can invoke so much complicated emotions. No? Yung mga ganon. So that means, kaya hindi natin ma-pinpoint which part of the brain. So yung mga forgetfulness na ganyan, oftentimes we need to ask, especially with younger adults, what may cause it. An individual who's very preoccupied with a lot of things, for example, they have a deadline coming up, so that means their focus is on there. So yung attention nila to other trivial aspects of their lives, like where did they put their keys or where they put their glasses, oftentimes that's wala na yun kasi nga those things are taken for granted, no, because their mind is focused on something else. So that I'm referring to what we refer to as working memory, no, or at yung immediate memory natin. So that's why let's say yung something that they did yesterday becomes totally not forgotten, but something that's not accessible to immediate memory. Okay, so titingnan ko muna kung ano yung sitwasyon, because it may mean simply that because they're preoccupied with something else. Pero titingnan ko rin kung if it's a persistent pattern of behavior, and then titingnan ko rin at what point has this become adversely affected their life. Kasi kung to the point na because of their persistent forgetfulness of where they put their car keys, they're always late for work or they're always late for school, yung mga bagay na ganon, then we need to really look into that. And that's why we could test, do screening and see kung anong estado talaga nung pagkakamalimutin ng taong yun.
And just a follow-up question to that, Doctor. Now, we talk about early onset. May particular age ba that would qualify for that early onset of dementia?
Well, generally cutoff namin would be 60 kasi yung what we call idiopathic Alzheimer's. I'm sorry. Yung other causes like vascular dementia, that can occur at any age. Kasi nga, as soon as, sabi nga, that's due to stroke, So kung 40, 45 years old ka, nagka-stroke ka, then, that can have an effect on that. Pero yung what we call Alzheimer's, typically kasi yung Alzheimer's, yung manifestation will come at the age of 60. Meron tayong tinatawag na early onset. So that means mga middle age sila. Yung symptoms nila typical of yung classical development of the illness similar to Alzheimer's. So we will describe that as early onset dementia. Walang specific age. Ang cutoff lang is that it occurs usually before late middle age or before old age.
Or it also can be triggered by a particular, for example, accident or, di ba, that would involve nabagok yung ulo,
Right.
di ba?
Well, lovely you mentioned that kasi that's one of the causes then. I didn't mention that because, for example, if you've seen this movie by Will Smith about football players and then also mga boxers. In fact, sa mga boxers, the term that was used before was dementia pugilistica. Okay. Kasi di ba mga pugilist na mga boxers. So yung repeated, but now the term that we use now is TBI, traumatic brain injury. Pero yung manifestations nila is also similar to Alzheimer's. Nagkaka-dementia picture din sila like forgetfulness and other disturbances in cognitive functions. Kaya, for example, hindi makapag-calculate, no, yung mga ganon, hindi makapag-reason out. So, yun, repeat. But usually that would be repeated brain injury katulad with football players and boxers. So we will call that TBI or traumatic brain injury.
Before we go to the question of John Ray, mamaya, ito muna, Doctor, the role of anesthesia. Yung iba kasi, di ba, pag nag-undergo ng anesthesia, may mga segments na nagkakaroon sila ng forgetfulness. Is this something to worry about that would lead to dementia?
Ako personally, no. And the best person to answer that would be an anesthesiologist. Okay. Yeah. I think basically that's a myth, no? It's always been said na people rationalize na anesthesia, naoperahan kasi ako so baka sa anesthesia, lalo yung mga misis ng tahanan na nakailang deliveries na, nakailang cesarean section, so they use that. But I haven't come across really definitive evidence that will impact on memory.
Okay. Now we go to the question of John Ray. Sabi niya, Doc, is it true that as we age, as our body needs exercise, it is also a must to do exercise on our brains? What are good brain exercises?
That's a good question. At any age, exercise would be good. And as we grow older, especially the more sedentary our lifestyle becomes, then movement, kinetic movement becomes really very critical and very helpful. Di ba nga, recent studies in the last few years have shown that one of the leading causes of heart disease is actually a sedentary lifestyle. Okay. So, moving about. Pero yung sinasabi niya, exercise for the brain. I always recommend that. Yeah, yes. Actually, yes, may mga tips din yan and that includes yun na nga exercising your brain. Like my mom, nung nalaman niya Sudoku can help. So lagi na siya nagsusudoku. Nung bumibili pa siya ng mga booklets. So it can be something like crossword puzzles, anything challenging. Particularly, I would prefer yung something that will involve eye-hand coordination. Yung may involved ng vision and also tactile or kinetic movement. Kasi mas maganda yun and that will be more helpful. But yes, I would recommend that. But it should start early on. So that means yung buhay natin continue from a very younger age. We should train. We should make it a habit to constantly mentally challenge ourselves.
Example dyan, Dr. siguro yung chess. You have your eyes and your yeah. Chess. Okay, another question from Maria Arumin. Doc, can you provide us certain medication to help us the delay of forgetfulness? Siguro magpa-check up na lang. Meron ba mga nito? Supplements or mga over-the-counter?
Ang problema doon sa mga supplements, mga over-the-counter, di ba, papalabas nila yung advertisement. Tapos anong sasabihin nila sa dulo? No therapeutic
claim.
So that means hanggang salita lang sila, pero wala silang ma-prove o wala silang pruweba na talagang nakakatulong sila. Ayoko na lang magbanggit ng mga pangalan, baka matiwan. Pero pag sinabi yun di ba? Pag sinabi nila yun, no approved therapeutic claims, yung mga gano'n. Actually, meron, pero kasi depende yun depende kung ano yung extent ng memory deficit. Okay. But you need to be able to, an assessment would be good. Siguro screening like tulad na napag-usapan natin. Okay.
Yeah, and as I said earlier, it's better to have, to go to your doctor para mas mabigyan ka ng prescription medication. Okay. Mga lahi.
Kasi additional, Kasi po, yung pag-inom ng gamot, hindi napakasimpleng bagay yan eh. Kasi tandaan natin na pangkalahatan nila, when you take a medication, it has an overall impact. So that means your doctor has to assess other parts of your body, yung performance ng lungs nyo, yung puso nyo, yung liver nyo, yung kidneys, because any medication may have an impact, okay? May magkaroon ng epekto dun sa iba't ibang parte ng katawan natin. Kaya mag-ingat po tayo dun sa basta na lang sasabihin, inumin mo to, no, makakabuti to sa iyo. Kasi mas mabuti kasi masuri talagang muna mabuti yung pangangatawan natin kung nararapat yung gamot na yun. Because some medications can be good for a particular condition, pero let's say kung may problem ka naman sa liver na magiging hadlang sa pag-inom ng gamot na yun, mabuti pang wag na lang. Okay.
Yeah. Okay. From Mr. Alan Astrologo, sabi niya, mga lahi sa side ng mother ko nagka-Alzheimer's disease. 4 sila magkakapatid. Ang isa namatay 88 years old with Alzheimer's. Ang bunso nila ngayon, 86 years old, nag-manifest na ang Alzheimer's. My mom is 92 but still sharp. Bakit may mga ganun, doctor?
Kasi yun yung tinatawag natin, yung Alzheimer's kasi, especially yung late onset na tinatawag. Idiopathic yun eh. Excuse me. Some individuals kasi we each have different lives, di ba? Very heterogeneous. We're each different individual. So that means, for example, yung mother niya na tinutukoy niya, maaaring iba yung naging lifestyle, no? Mas mapangalaga siya sa sarili niya, sa health niya. About 10-20, sabihin natin 20 years ago when I was starting out in the 1990s, the WHO came up with a program. They said that if we can control 2 diseases, which is diabetes and hypertension, okay, then that can help minimize the incidence of dementia. In fact, in Western countries, North America and in Europe, they've already seen the benefits of that. No, 10, 20 years down the line, they're seeing possibly that the incidence of new cases of dementia are decreasing. Okay, and it could be attributed primarily to improving lifestyle and at the same time controlling 2 high risk conditions. No, so titignan din natin yung individual na sabihin 92 pero ang talas-talas pa ng pag-iisip. Paano yung naging buhay niya? No? Mapangalaga ba sa sarili niya? So it doesn't mean kung may hypertension ka or diabetes ka na you're going to be at risk. It depends on how well you control those conditions. No? So kung control yung blood pressure mo, control yung blood diabetes mo, then that can help. Kaya nga yung gobyerno natin, di ba, namimigay ng libreng mga gamot for hypertension and for diabetes. Because again, that's part of the WHO program in terms of controlling these 2 conditions to help minimize not just the risk for dementia, but also other morbid conditions.
It's very interesting to know na yung mga sakit nagkakadugtong-dugtong lang. So I hope that answers your question, Sir Alan Astrologo. No? Maybe yun nga yung nangyari sa mom mo, kaya she's not having dementia. Okay, doctor, we will be entertaining one more question before we end because it's 4 minutes before 4 o'clock. And I think this question talks about how do we further increase awareness about dementia?
Yung mga organizations ngayon nga, like yung nabanggit ko kanina, yung Dementia Society of the Philippines at saka yung Alzheimer's Disease Association of the Philippines. And also, for example, like I used to work at the Geriatric Center of St. Luke's. So they conduct lay fora. No? They have a Facebook page. No? So they have social media as well. So they try to be able to spread the news as best as they can. So malaki na nga naging role ng social media as far as that is concerned. Okay. Kasi for example, isang ahensya ng sangay ng pamahalaan makakatulong would be, for example, yung Senior Citizens, Office of the Senior Citizens Affairs. Kasi syempre concerned din sila dapat dito. You know? And also the Department of Health. Hopefully the government can have more programs. The DOH a few years ago, sometime ago, they opened the hospital specifically for elderly. No? Nag-open sila ng geriatric hospital. But I heard recently that's been closed. I'm not sure why, but sayang. So yun, that would help, you know. And then like in what you're doing right now, this hopefully could help as well. So mga NGOs and government organizations and also private citizens also can help in this regard. What I do naman is, for example, I conduct trainings to psychiatry residents, so to be able to so in this situation nga pala, I'd like to say hi to the residents of the National Center for Mental Health who are listening. I'll talk to you again tomorrow, and also the residents of the UERM Department of Psychiatry. Okay. So I try to spread the word by training younger doctors, younger psychiatrists, so that they'll be in a better position to help individuals in the future with dementia. Kasi sa pagkakala mo, Fort, di ba, 4 lang kaming geriatric psychiatrists sa Pilipinas. Kaya kailangan namin ng tulong ng nakararami naming mga kabaro sa Philippine Psychiatric Association para mas matulungan natin yung mga pasyente na may dementia.
Okay, Doctor, it's really an interesting session with you this afternoon. Ang dami namin natutunan about dementia. Ang dami may mga myths na resolve, na bigyan ng kasagutan. Before we end, I'd like to greet my mom na nakikinig ngayon. Nasa Jensen siya. Hi, ma. Also, I would say good afternoon sa Canlas family na nakikinig din ngayon nasa Quezon City. Si Tita Lynn, si Tito Romel, si Lola na nakikinig ngayon, at nanonood pala si JM, si Jerome, and ewan ko lang po si Jello and nanonood. Good afternoon sa inyo lahat, and maraming salamat sa nakikinig. Well, guys, thank you, Doctor, for joining us this afternoon, and I hope that we can still invite you in our future Health Talk episodes.
Sure.
Okay, mga kaibigan. So, sabi nga nila, prevention is better than cure. Kaya sa mga younger generation na nanonood ngayon, check your lifestyle. Sinabi na rin ni Dr. kanina, no, about sedentary lifestyle. That's really a risk factor to develop dementia and some other diseases as well. There's still room to change. Our topic today also reminds us to cherish every moment you have with your loved ones. The pandemic gave us that opportunity to spend more time with them. Ako po si Forge Sagabay. Maraming salamat sa inyong pagtangkilik sa programang ito. Every week, we present different health-related topics to educate everyone about certain conditions and illnesses. So please share Health Talk to your friends and loved ones, and also like our Facebook page as well. I'm leaving you guys with the music video from Musicatria entitled The 80s OPM Medley. Kaya wag muna kayong umalis, and I hope that you'll enjoy this video. Bye, everyone!
So now my love for you, baby, I
You're a hopeless romantic is what they say, falling in and out of love just like a play, memorizing each line. I still don't know what to say. What to say? Don't know what to do whenever you are near. Don't know what to say. My heart is floating in tears. When you pass by, I could fly. Every minute, every second of the day, I dream of you in the most special ways. You're beside me all the time.
You push me up when I'm about to give up. You're on my side when no one seems to listen. And if you go, you know the tears can't help but show. Break this heart and tear it apart. Suddenly the madness starts. never dream, 'cause I always thought that dreaming was for kids, just a childish thing. And I could swear love is just a game the children play, and no more than a game. Till I met you, I never knew what love was. Till I met you, this feeling seems to grow more every day. I love you more each day. Till I met you, I never knew what love was. Till I met you, this feeling seems to grow more every day. I love you more each day. Till I met you. I'll never say goodbye. There are no reasons why. Our souls are so entwined. There is us, not you and I. Our friends will soon regretting we once met, because we'll show them all where in love we can water, and we will never ever say goodbye. Say goodbye. There are no reasons why. Our souls are so